This is a very complicated clinical situation that this person's asking about, and it can be a little scary too. So I want to take my time and answer this question with a lot of compassion. So the question is, I had an ectopic pregnancy a couple of years ago, and I've been trying to conceive for a while now. So the timing is that she's been trying to conceive for almost a year. And she's asking for advice. So, one of the things to think about with an ectopic pregnancy is why did it happen? So, ectopic pregnancies can be incidental, meaning we have no idea why, or ectopic pregnancies can sometimes occur if there's a problem with the tube. So, what happens is the egg ovulates from the ovary. Let's say the ovary's here, and then the tube kind of pulls the egg into the tube, and then the sperm, which goes up into through the cervix into the uterus and then out the tube. The sperm's coming down the tube while the egg's getting into the tube. The fertilization occurs in the tube. Bet you didn't know that. So the fertilization occurs in the tube, and then that fertilized egg has to start working its way down the tube all the way to the uterus. And if there's a problem in the tube with the tubal motility, or there's scarring, or there's a blockage in there, then that pregnancy can implant in the tube and start to grow anywhere along the tube, or even on the ovary, or even just inside the uterus, but not in a space that has enough space to grow. So that would be a cornual ectopic pregnancy. And the answer to this question really has a lot to do with why did that ectopic occur? So if this person has scarring in the pelvis, for example, from previous surgery and a ruptured appendix, or has had an infection in the pelvis, like a pelvic inflammatory disease, or has had anything else that may contribute to tubal issues like endometriosis, or other things in the pelvis, then the ectopic that occurred in the tube may be an indicator that there's a problem with the other tube. And if both tubes are blocked, then it really isn't possible to get pregnant through the natural way. It would then require IVF or in vitro fertilization. And so I know that there's a lot in that answer, and that this person is going through a lot to have had an ectopic and to now be having trouble conceiving. My main piece of advice is to immediately go see an OBGYN, have a workup, have your tubes evaluated, and have an entire evaluation to determine what is going on in terms of your future fertility and to get specific answers to these really important questions.